COVID cases continue to rise in Arkansas, but it's not the same story that we've seen when it comes to hospitalizations. Thanks for joining us at 5. I'm Rolly Hoyt.
And I'm Marlisa Goldsmith. You probably know of someone right now who has COVID because the virus is spreading. But the good news is the hospitals aren't flooded with these patients.
So THV 11's Mercedes McKay asked doctors if this means we're at a new point in the pandemic.
The halls at UAMS are always busy.
Hospitals don't tend to run with lots of open beds.
But unlike a majority of the past 2 years, the pandemic isn't the main driver.
At least COVID is not an additional pressure to the normal things that we see this time of year.
While COVID patients aren't taking up the hospital beds, it is once again spreading throughout our state. 2 days in a row, cases have topped 200. But that isn't a shock to Dr. Robert Hopkins.
Most people are not really doing much in the way of public health protections, and we don't have a highly vaccinated population. So I'm not terribly surprised to see rates going up.
Currently, UAMS has just 10 COVID patients. That's far fewer than what they've had in the past, though Dr. Hopkins is still cautious.
The challenge is that 10 where we're going to peak out, or do we still have a lot of ways going up? And I'm hopeful that we're not going to see a big surge up in hospitalization numbers from that.
Over at Conway Regional Hospital, CEO Matt Troop is holding on to that same hope.
It is nice, actually, to see almost a sense of relief on people's faces. There is a sense of a joy again.
Right now, the hospital is just one COVID patient, a feeling that Troop says is hard to put into words.
We've been through these peaks and valleys so much that I think we're taking it more in stride, knowing that if another surge happens, we're prepared for it.
While they're ready for it, Troop doesn't believe hospitalizations will ever hit those levels again, since we could possibly be turning a new page on the pandemic.
Time will tell, but I think the prevalence of the virus combined with vaccinations have helped to keep hospitalizations low.
Mercedes McKay, THV 11 News.
Mercedes, thank you. With cases up, it's important to remember the guidance that if you test positive, stay at home for 5 days. Make sure you get tested again after that. Also, if you've been exposed and test negative but are vaccinated, you should wear a mask around others just to be safe.